Great. Thank you so much. So one thing that wasn't said was, so this is a multi-state project. So 8 different states. You'll see more about that in a minute, but Wisconsin was one of them. So you may have heard of SPSK, Supporting Parents, Supporting Kids. So SPSK is the Wisconsin version of the CSPED program. I'm going to talk about CSPED as a whole, but give some little shout-outs to Wisconsin from time to time. Some of you may also know that we are planning to move on and expand and extend the Wisconsin version of the project. And so we're going to try to present our findings and think together about what that might mean for going forward. All right, now we have about 1 million slides, so I'm going to go really fast here. Thank you to a whole bunch of people. Thank you to a whole bunch of other people. I want to just start with some background to help set the context. So these things I think I don't need to say probably in this audience. Increases in single-parent households, child support system designed to ensure that non-custodial parents contribute financially to the upbringing of their children, but it doesn't work very well for lots of families. It does work well for some families, but for lots of families it doesn't work well. And there's the most recent national survey data. So one place that things fall out is only 43% of custodial parents were supposed to get something in 2015. And among those, only 44% received the full amount due. So we have big leaks in this bucket at 2 places. So it doesn't work very well. Why? Here's some reasons. So lots of non-custodial parents have limited earnings and ability to pay, so it's hard for them to make those contributions. Some NCPs have had kids with more than one person. Some of those have trouble contributing even to one family, and especially trouble then contributing to multiple families. So that's a particular problem. The child support program itself might be creating some problems. So we could have a little fight about this later if you wanted, but here we've just said most of the focus traditionally has been on collections. Most of what they've done is given threats and punishments when collections don't come in. So it's been more of an enforcement, or maybe you could think of a stick program than a carrot program. So few incentives to do the right thing, more punishments for not doing the right thing. And some of the threats might actually be counterproductive. So one thing that happens is we can suspend a driver's license. Eventually, incarceration can occur. You could imagine that if you take somebody's driver's license away, that might not help them pay in the future, right? And if you incarcerate someone, that probably is not going to put somebody on a trajectory to making their full payments. So maybe the child support program itself is part of the problem. And so there has been a growing sense that children could benefit from a different kind of child support system, one that not only enforces contributions, but one maybe that enables and encourages NCPs to make contributions. Okay, so in that context, the Federal Office of Child Support Enforcement awarded grants to child support agencies in 8 states, including Wisconsin, to try a different thing. So to do a different intervention with NCPs who are struggling to meet their child support obligations. So we'll talk more about what that is. And then they also awarded a cooperative agreement to you, to DCF, to procure and manage an evaluation through an independent third party. And you picked us, along with our partner Mathematica, so that that's sort of a cast of characters. So we were younger when this started. So first there was some planning period, and then the demonstration actually started in October of 2013 and ran through September of 2017, and we released the final report in March of this year. Okay, so that's sort of getting us started. what we're going to do now is talk a little bit about the intervention itself and some of the things we learned about first describing the intervention and then a little bit from the implementation report. And then we're going to focus on impact from there and then a little bit of benefit cost, one slide. And then we're going to focus mostly on the lessons that we learned. So Lisa's going to take over from here.
Can I have a clicker? Thank you so much. All right, thank you very much, Dan. Quick question, has anyone here heard results from CSPED before in a presentation or heard anything about the background of CSPED before? Okay, a little bit. All right, so because we've got a lot of folks who are new to CSPED, I'm going to spend a little bit of time on these slides going through the program in a bit of detail. But if there are questions, raise a hand. I'm happy to take any as we go. So as Dan mentioned, CSPED was implemented in 8 states across the United States. We have 8 grantees who served as child support grantees for the program. We have representation as far west as California, as far east as South Carolina. Here in Wisconsin, we had 2 implementation sites located in Brown County and Kenosha County. This slide provides an overview of the key elements of the CSPED model. And there are a couple of features of CSPED that were quite innovative that we want to highlight here. So the first is that under CSPED, in all of our CSPED grantees, the Child Support Agency acted as the lead agency. So they provided leadership, oversight, and coordination, which is not always the case in employment demonstrations. In fact, that's quite rare and innovative. So that's a feature of CSPED that we're able to look at in greater detail as a result of the evaluation. Child support agencies weren't going it alone. They partnered with community organizations that received funds through OCSE to provide services related to a couple of different buckets that I'll walk through in just a moment. So we've got a child support-led, partner-administered organization through CSPED. CSPED had 4 core types of services, and we'll talk more about these as we go, but a quick overview now. The Child Support Agency provided a package of enhanced services. These ranged and in some cases varied across grantees, but the idea here is how can we do some things that might make it easier for folks to comply with their child support obligations. And so these included things like review and potentially modification, if appropriate, of child support orders. In most grantees, consideration of whether or not it's possible to forgive state-owed arrears, and relief from certain enforcement actions. The Child Support Agency was also responsible for providing domestic violence screening and referrals when appropriate, as well as implementing some safeguards related to domestic violence. So our Child Support Agency partnered with 1 or more additional agencies to implement services for non-custodial parents assigned to receive CSPED services. Employment services are really a cornerstone of the CSPED model. Employment services being the idea that if we can get folks to work, we can help them be in a better position to comply with their child support obligations. And OCSE required some sorts of services, things here like job readiness, job search, job placement services, and job retention services, and then also recommended additional sorts of services that, if possible and available, they'd like to see our employment partners connect non-custodial parents to. Things like job training, as well as assistance with expungement. Our parenting service providers were sometimes the same as employment service providers if that agency had the capacity to do both, and sometimes they were different. Parenting services were the only type of service, the only category of service in which the Office of Child Support Enforcement provided a guideline about how much service they expected non-custodial parents to receive. So in the case of parenting services, OCSE said, well, we expect that non-custodial parents to get about 16 hours of services. You can use any curriculum that we approve to provide those services. All of the curricula that OCSE approved had components such as personal development, responsible fatherhood, parenting and relationship skills, and attention to domestic violence. The 4th main category of service is case management. This looked a little different depending on the grantee. Typically, there's a case manager housed in the Child Support Agency. Sometimes that primary case manager was housed in a partner agency. Sometimes we had case managers in both working together. And what our case managers were tasked with is kind of figuring out where's the non-custodial parent at when they come into the program. What needs do they have that need to be addressed? What sorts of services can we put into place to help this individual? How can I monitor progress to make sure that they're meeting the goals? that we established for the non-custodial parent. And the goal here was for all of these services to function together as a packet of services. In other words, our non-custodial parent isn't going to 4 different places to seek out what they need. Rather, they experience this as a comprehensive set of services intended to wrap around the non-custodial parent to get them the support that they need depending on their circumstances. So there are some challenges that come with child support agencies being in the lead. One of those challenges is that some non-custodial parents are really not very inclined to come into contact with the child support agency if they don't have to. This top quote, I think, kind of summarizes this challenge pretty well. We have a CSPED fatherhood partner who says, the perception is nothing good comes from child support. So after a lot of decades of some non-custodial parents experiencing the child support system as being extractive and punitive, and rather than a place where they could go for help, there's some resistance among some non-custodial parents to engage with child support in something new. But there are a whole bunch of reasons to think that it might be a good idea to have child support in the lead, which is part of why, through CSPED, we decided to do something different and see if this works. And here are a couple of the advantages that we could talk about. So one is that child support agencies are uniquely positioned to identify non-custodial parents who make up the target population. They've got a full accounting of who has a formal child support obligation, who's behind, how much are they behind by, and who do they owe that support to. They also have some access to the target population insofar as they've got contact information. So you can imagine if we had an employment agency in the lead, they might not have that same level of access. In fact, they wouldn't have that same level of access to identifying the full target population. So child support in the lead provides a significant advantage in that way. Child support agencies also have information about the full family context, so they know whether a non-custodial parent might owe obligations across multiple households, which is something that can make it a little more difficult to comply and might be something that requires some supportive services in the course of service provision. And as Dan mentioned, there are some actions that child support agencies take that can, in fact, themselves disrupt financial stability. So if we think of things like license suspension, which might make it harder for a non-custodial parent to get to work, or incarceration as the result of contempt actions and other related actions, that might make it harder for a non-custodial parent to maintain that job that they've got. So our child support agencies are sort of uniquely positioned to take actions to alleviate those sorts of enforcement actions in a way that a parenting provider or an employment provider simply is not able to do. Okay, so given all of that, we're going to spend a little bit of time now giving just a high-level overview of the evaluation. Dan will talk in greater detail about the impact evaluation in a bit, and I'll talk a little more about the implementation evaluation when we get to that component. The main question that we sought to answer through CSPED is, did CSPED increase the reliability of child support payments? And to answer that question, all of our grantees, all 8 of them, and all 18 implementation sites are part of a rigorous randomized control trial. So what that means is that when folks enroll in the program, they're randomly assigned to one of 2 groups. One group receives the package of enhanced services that I just described a moment ago, and the other receives services that are already available in the community to non-custodial parents. I think it's important to note here, nothing was taken away from non-custodial parents. It was the case that there is already some services, some base level of services available in the community that non-custodial parents could access. So it's a contrast between these extra services and services regularly available to non-custodial parents. There are 3 main components to the CSPED evaluation. We have an implementation analysis, which helps us to answer the question, how did CSPED programs operate? One way that I think of implementation analysis as being useful is that we can say something like, all CSPED programs are supposed to provide employment services. Well, what did that look like on the ground? What kinds of services did that actually represent within each grantee? And what conclusions can we make about that? So implementation analysis helps to inform those sorts of questions. The impact analysis helps us to understand whether or not CSPED programs improved outcomes. And the benefit cost analysis helps us understand whether those benefits outweigh the costs associated with administering such a program. So each of those study components has its own report. There's a 4th report that came out. All of these are publicly available on the IRP website, which is called the Baseline Characteristics Report. We also had a goal of increasing our understanding of what do non-custodial parents' lives look like? What is the context? What do their families look like? What kind of barriers and challenges do they face? And for that reason, we collected a bunch of information to help us better understand the sorts of things that non-custodial parents encounter in their lives. Okay, this is a bit of a busy grid, but I just want to point out here that we collected a lot of data for the CSPED evaluation. So each of the columns represents a separate analysis, and each of those has its own report. Each of the rows represents a different data source used to inform each of those reports. So we collected survey data, and a rather long survey, 40, 45 minutes. We collected survey data at baseline at the time of enrollment with all non-custodial parents, so all 10,161. That's a pretty big sample. We were able to do a lot of exciting things given the size of our population. 12 months later, we attempted follow-up surveys with our non-custodial parents. We collected all kinds of administrative records from things related to child support, employment and D&H records, criminal justice records, and public benefits use records. We also collected data on service use. And this was really important because what we had to do was work with our local staff to train them how to categorize information into a web-based system about every kind of service they provided to non-custodial parents through CSPED. So they recorded the type of service and the amount of service that each non-custodial parent received. And therefore, we are able to better understand what the dosage of each service was. We conducted semi-structured interviews and web-based surveys of staff, both child support and partner staff, at 2 different points in time. Once at early implementation in 2014, and then again when programs are kind of up and running at full implementation in 2016. And I'll draw on both of those data sources later today. We also conducted focus groups early on in the evaluation and collected program documentation along the way. Okay, so we know what the program's supposed to be. We know what the evaluation looks like. So let's spend a little time now just kind of going through what enrollment into the program looked like and who we ended up enrolling into CSPED. CSPED enrollment, it lasted for a 3-year period from October 2013 to September 2016. As I mentioned, we enrolled 10,161 non-custodial parents, half into that group that receives the package of CSPED services, and the other half that receives regular services. The Office of Child Support Enforcement gave some flexibility to our grantees to figure out who is it that they're going to allow to enroll into CSPED programs. But at a minimum, all participants had to meet these criteria. They had to have established paternity for at least one child and have at least 1 or more 4D cases. They also had to be having difficulty paying or be expected to have difficulty paying child support due to lack of regular employment. You can imagine with this last item, that's a place where we might see some variation across grantees depending on how we define difficulty paying or regular employment, right? And that certainly is what we saw in the course of CSPED. Some of our grantees used time or amount thresholds to say, you know, you have to be out of work for this amount of time before you're allowed in. Others did not. So this slide here provides a profile of what our non-custodial parents who ended up enrolling into CSPED looked like. So this is all 10,161 non-custodial parents, regardless whether they're in the extra services group or regular services group. And this comes from information reported at the time that they enrolled into the program, information that they shared with the telephone interviewer at that time. So the average age of our non-custodial parents is 35 years old, so not brand new dads and moms, likely non-custodial parents who had had some time in the system already. You can see relatively low levels of education, so about 26% of our non-custodial parents had not completed high school or received a GED. I'll just point out the last item on there, 31% had more than a high school degree, but only 2% had completed a 4-year degree. So pretty low levels of education. A really important finding and a somewhat surprising finding was that 26% of our non-custodial parents in our sample self-reported symptoms of major or severe major depression. So when we think about things that get in the way of working and paying child support, that's something we just want to kind of keep on our radar as we go throughout the conversation today. We see relatively high levels of family complexity. So close to 2/3 of our non-custodial parents have children with one or more partner. In other words, they're trying to meet obligations across multiple homes, which again can make it difficult to meet our child support obligations. We also found that in addition to being a non-custodial parent to a child outside of the home, about 1/3 of non-custodial parents who enrolled in CSPED also were the parent to at least one child living at home as well. And so that again speaks to trying to meet multiple needs, trying to take care of multiple kids, particularly in a context of relative economic disadvantage. And finally, I'll just point out here, we had almost as many non-custodial parents living with their own parent or grandparent as we did living with a partner. Okay, this slide is a lot. Try not to let it overwhelm you too much. what we've got in the columns are different characteristics, okay? And then what we've got in rows, in the top row is the average across all grantees, top yellow shaded row. And in the bottom row, we've got Wisconsin highlighted as well. So you can see differences across all grantees, but you might especially want to think about the all compared to Wisconsin. So overall, 90% of the non-custodial parents in our sample were fathers, 10% mothers. In Wisconsin, we have a little higher representation amongst mothers with only 86% fathers. Overall, about half of our non-custodial parents were never married to any of the other parents of their children. A little higher in Wisconsin, closer to 2/3. About over half of our non-custodial parents had worked for pay in the last 30 days, and that means any kind of pay. We're talking formal sector, informal sector, 1 hour of work, or 40 hours a week of work. So encompassing all of those, just over half had done some amount of work for pay, with Wisconsin looking pretty close to the average. Amongst those who were working, average earnings in the preceding 30 days were pretty low, and you can see a bit lower in Wisconsin. We see relatively high levels of SNAP uptake, and higher in Wisconsin than the average. And over half of our non-custodial parents were uninsured for health insurance at the time of baseline. And especially important over here on the right, I want to highlight we had 68% of our non-custodial parents overall who had been convicted of a crime. Of those 68%, almost everybody, so 97% of the 68%, had spent some time in jail or prison. So when we think about, again, those things that get in the way of finding and keeping work and ultimately paying child support, that's a pretty substantial barrier to reckon with. And again, nearly over 75% of folks in Wisconsin, so even higher challenges for our staff working in Wisconsin. So at the time of baseline, we asked non-custodial parents to tell us about the kinds of things that get in the way of finding and keeping work. So these are self-reported barriers to employment by non-custodial parents. And you'll see that some of these barriers speak to a lack of structural supports. So the most frequently reported barrier amongst non-custodial parents is problems getting to work. In other words, issues related to transportation. We also see that having a criminal record reported at relatively high levels. Things like housing instability also factoring up pretty high. Lack of job skills and some caregiving needs also factoring in. A little lower on this list, we see physical health issues, substance use issues, and trouble getting along with other people, so some issues that might speak to mental health. And I'll just note here that while non-custodial parents reported these at pretty low levels, when we ask staff about this, we've got really different, much higher rates of report of those sorts of things getting in the way of work. And we'll talk a little more about that in a minute, and we can talk, if there are questions later, about why it might be that there would be some differences. Okay, so given that things that get in the way of work get in the way of paying child support, we wanted to dive deeper in the course of the implementation analysis into the kinds of things that get in the way of complying with child support obligations. And so to do that, both for the CSPED evaluation and then some additional analyses that some of you might be familiar with through the Child Support Research Agreement Task 8 report, we highlight some of these different kinds of things that get in the way of compliance. And we categorize these into three main buckets. These are practical impediments to paying, some system-related barriers to paying, and previous interactions with the child support system. And I'll go into greater detail about each of those in just a moment. But a key finding that emerged across these analyses is that for a lot of non-custodial parents, there's not just one thing getting in the way of paying child support. Often barriers are multiple, and they interlock with each other, and they're complicated. It's also the case that sometimes those barriers require help beyond child support services. They just fall outside of the realm of things that child support agencies typically do. Okay, so I'm going to walk through each of these sets of barriers to compliance. The first is that we heard from staff, both at child support agency and partners, that barriers to work make it hard for some non-custodial parents to comply. That's probably not too surprising. And also highlighted that barriers to work make it hard for non-custodial parents to meet their own basic needs. So when we have folks who are struggling to meet their own basic needs and making choices about what to pay and where, that can get in the way of compliance. Some of these barriers are specific to employment, things like limited, lacking work history, lack of job skills, education limitations, and literacy barriers. And some of these barriers are a little more indirect. So things like having a criminal history that might make me less lucrative to a potential employer, housing instability, which makes it hard if you're not having that basic need met just to move forward with obtaining work, And even things like interviewing can be a lot more complicated if an employer is not able to communicate with you where you're at. Mental health and substance use issues, as well as childcare and transportation. I think this top quote really helps to illustrate how those indirect barriers can kind of get in the way of obtaining work and complying with child support orders. So we heard from a CSPED project manager is that there might be barriers that they need to rectify before they get a job, before they can even look for a job. So in other words, before we can count on somebody to engage wholeheartedly in a job search, if they're in the throes of a mental health crisis or not in a stable housing situation, that might be something we have to address before they can be counted on to look for work and keep work. And the second quote here highlights the challenge that comes with employing folks with a criminal background. So the second practical impediments to compliance that we heard about is that even for our non-custodial parents who are able to find work, the kind of work that our non-custodial parents were finding was often inadequate as far as wages relative to their obligations. And it's the case that those barriers we just talked about, the things that make it hard to find work, are the same things that make it hard to find well-paying work, right? That's probably not surprising. Low levels of education, lacking job skills, also make it difficult to find jobs that pay well enough to meet the obligations that some of our non-custodial parents have. We heard that this was especially problematic for non-custodial parents who have multiple cases and likely higher order amounts, as well as high burden orders, or orders that comprise a significant share of their income. We also heard, both from child support staff as well as partner staff, that imputation practices and challenges getting a modification can exacerbate this problem, because that keeps orders high relative to what non-custodial parents are able to pay. And this quote from a CSPED project manager here, I think, helps to illustrate this. So when you're getting a limited income and the job pays $10 an hour, but half of what you're making is still getting paid, taken out in child support, sometimes the guys get discouraged. Okay, so I'm going to talk just a little bit here about system-based barriers to compliance. Dan touched on some of these earlier. Key finding, and again, we heard these from both child support staff as well as partner staff, is that sometimes the actions that child support agencies take can reduce the ability of non-custodial parents to comply, as well as willingness to comply. So if we think about things like license suspension and court actions, we've already gone through the reasons why that might make it hard to both work and then ultimately comply with child support obligations. If we think about things like really significant accrual of child support arrears and interest, compounded by the fact that when orders are high, that's going to be more difficult to reckon with ultimately, that can decrease willingness to comply as well. Because why should I try if that mountain is so high that I feel like no matter what I do, I'm not going to get to the top? So that's a theme that we heard across both child support and partner agency staff. A second system-based barrier to compliance that we heard about related to willingness to pay is that barriers to visitation can also affect a non-custodial parent's willingness to comply. What we heard is that when non-custodial parents didn't have an avenue to get to see their children, that could contribute to frustration, just lack of buy-in with the agency and with the well-being of their child overall. This was especially an issue for unmarried non-custodial parents, whereas our married non-custodial parents typically have a vehicle through the divorce process to obtain visitation time with the child. Unmarried non-custodial parents don't have that same automatic pathway, so it's more of an issue for them. And furthermore, legal resources to obtain help with access are broadly lacking and often cost prohibitive, especially given the limited economic resources that folks in our sample had. And I think both of these quotes help to illustrate. The bottom one from a fatherhood partner, I think, really helps to highlight. You can tell him that his kid doesn't have clothes all you want, but if he can't see the kid for himself, he's not going to believe it. And finally, going back to something that Dan mentioned earlier, we heard from CSPED staff and partners that previous interactions with the child support system contributed to negative perceptions of child support. We heard about things like sting operations, where in the past, sometimes non-custodial parents heard that there was going to be an opportunity for amnesty, and instead of an opportunity for amnesty, they ended up in jail. And that might not be something that happens a lot, but I'll tell you what we heard from non-custodial parents is it only has to happen once or twice before word gets around that that's a thing, and then people get really nervous. Fear of consequences, fear that if one comes into contact with the child support system, that could risk arrest, jail time, and seizure of the very limited resources that they've got. And then just stigmatization, just feeling as though that these are people who look down on me and aren't very interested in my well-being and don't see me as somebody who's able or willing to contribute. Okay, so given all of these barriers, the challenges that we've got, And given what the CSPED model is supposed to be, I'm going to spend a little bit of time talking about the services that non-custodial parents in the extra services group actually receive through CSPED programs. Okay, so as a reminder, it's supposed to be 4 core sets of services: employment services, parenting services, enhanced child support services, and case management services delivered by child support staff and partners. What we found through the course of the implementation analysis is that there's variation both across grantees and sometimes within grantees. So recall that our CSPED grantees often operated multiple implementation sites. So sometimes we've got one site doing things a little different from other sites. And some of the ways that we saw this variation was in domains such as service delivery configuration. So who's providing what kind of services, who's responsible for case management, how many partners are involved in the arrangement. Subcategories of services varied. So some of our grantees were not able to offer state-owed arrears compromise, others were. Some made a lot of headway on doing things like partnering with expungement providers, others did not. We also saw variation in the extent to which additional services were available. So we had 2 grantees who provided a really robust set of financial literacy classes along with their core set of services and tacked that onto their CSPED model. Others did not, and similarly with some help around parenting time. We saw variation in the mode of service delivery as far as individual versus group-based administration of services, and as I'll show you in just a minute, some variation in the dosage. But overall, when we look across all 8 CSPED grantees, what we see is that this was a pretty modest intervention. So on average, a non-custodial parent who took part in CSPED received about 21.7 hours of services. So that's pretty modest relative to what it might have looked like, especially if we keep in mind that the Office of Child Support Enforcement's expectation was that there'd be 16 hours of parenting services, right? So pretty modest. I'd also just mention here that as an example, when we look at employment services, the most common uptake in services was around these really foundational services. So things like job readiness, job search, help with a resume, job referrals. Much less frequently were non-custodial parents receiving help related to getting into vocational training, subsidized employment, those kinds of things that could really provide a pathway to a higher paying job. Okay, so this bar graph here shows you how service hours were distributed across those 4 categories of services as well as other services. So the top bar is the average across all grantees. So as I said, 21.7 hours of services overall. You can see that about 10 hours of those services were provided in the realm of employment. The rest are distributed across case management, child support, parenting, and other types of services. So here again, I'll just highlight, we thought we were going to get 16 hours of services in parenting, on average less than 4. Wisconsin's pattern looks pretty similar to the average overall. Yeah. That's a great question. That's within the other. Yep. And financial literacy. Oh, I'm sorry. Repeat. Yeah, we had the question of, for those of us who are not in the room, of where domestic violence services fell, and those fell into the other category. Financial literacy and other sorts of services like that in that same bucket. Great question. Okay, this is a lot. This slide shows variation within and across grantees. So before I overwhelm you too much, I'll ask you to just take a look at those brown bars. So we're looking here, here, and here. And what those brown bars show is the distribution across percentiles of service delivery. So on the left panel, we have those at the 25th percentile. So if you lined up everybody in a row, took the person who's at the 25th percentile, how many services they got. The 50th percentile in the middle panel, and on the right panel, the 75th percentile. And what we see is that for our person who's at the 25th percentile, on average, that person received 5.5 hours of services. So quite low, right? Quite different from our mean or our average of 21 hours of services. Our folks in the 75th percentile, on average, received about 33 hours of services. So a lot of variation here. You can also see, so we show bars for each of the various grantees. Wisconsin, again, pretty close to our average. We have a couple of grantees who jump out as really high levels of service hours. I'm looking at South Carolina and Ohio. Okay, so with all that in mind, are there any questions before we turn to the impact evaluation findings? I'll give it back to Dan. Yeah.
I just want to interrupt.
Oh, sorry.
If folks are going to ask a question, you'll have to put up.
Oh, sorry. It's over here.
Oh, no,
There you go.
Um, and the barriers, I'm not sure you would have looked at this, but it just occurred to me, you were talking about how many, even when they are working, still had difficulty meeting their assigned obligation, and the system is a little sticky about how easy it is to get adjustments. But I wonder if there was much variation, as far as you know, among states in their percentage standards as far as how far the bar is set, because I was thinking that if you're very low income, the feds were requiring almost an exception to the standards, that it had to be taken into account more and more. But I'm imagining there's a lot of inertia, but I also wonder if in big picture, you know, that creates some difficulty evaluating across states.
So there is substantial difference in the guidelines, so the amount that's expected for cases with different characteristics, and particularly at the low end. There's also significant differences in the flexibility that different states had to do modifications. So Tennessee, the rules about the degree of change that you have to demonstrate before you can pursue a modification was very high. So very few modifications there. So the way we approached that was all of these analyses are done separately by grantee and then averaged across grantees. So there is some data in the report that pulls that out separately. We did try to account for that. Good. Okay, I'm going to move along to the impact evaluation. And the first thing I need to say is that this is a wide-ranging intervention. And so kind of the key threat is that if we looked at everything we were interested in, we would find some things that are statistically significant. So just by chance. So the sort of standard is to say if there's less than 1 in 20 chance, then probably you found something. But if you're testing 800 things, then you're likely to find some things just by chance. And so our approach was that we had to try to figure out what was going to be most important before we even looked at the data, to try to say what are we going to see as the most important impacts, and sort of the success of CSPED will rise or fall on a few things. And then later we can look at other things too, but for the bottom line finding, we have to sort of preset what we're interested in. And so we did. We picked 14 things that we're going to call confirmatory outcomes. And you'll see those in just a minute as I walk through these. In fact, I'm going to skip this slide. Before we look at those impacts in those key areas, there's 3 kind of preliminary questions that need to be asked and answered. First one is, did randomization work? So everything flows from this idea that people are randomly assigned to either get extra services or regular services. And then if that works, then all you have to do is compare those 2 groups. But did it work? So what we did was compared the baseline characteristics of the people in the groups, and the bottom line is it worked. Yay. Second question, was this necessary, the randomized control trial? Could we just have done a pre-post? And the answer to that here in this case, we think, is yes. And here's just one example. So this shows the unemployment rate in each of our states over this period. So look at this direction, right? This is a period of the economy getting better. And so every year, people's payments went up, whether they got extra services or not, right? And so just looking at what people in the extra services group got, we would have shown improvements, right? But it wouldn't have shown differential improvements. So compared to what everybody else was doing. So that's what the power of the experiment is we get to compare not just before and after, but how before and after does compared to other people who weren't getting this extra service. All right. I'm going to skip that. And then the third thing you're worried about is, well, did the extra services people actually get more than the regular services people? Was there an intervention? Lisa showed what people got in the extra services group. That comes from the management information system. But that doesn't tell us what people in the control group got. So to get that, we have to ask, basically, in a survey. So we have survey questions where we ask both people in the extra services group and in the regular services group, how much of this did you get? Did you get any of these services? And then we can do a comparison. And yes, so here's those comparisons. 14 additional hours of employment services, 7 additional hours of parenting services, 1 additional hour of child support services is what people report. So about 22 hours more. So this is people's reports of services, right? So I don't necessarily know how much work my child support worker is doing behind the scenes, right? I probably don't have a very good measure of that. But I do know how much face-to-face work I'm seeing. And so about 22 hours spread across the first year. So just like Lisa said earlier, fairly modest intervention given that these are people with multiple challenges. Yeah. And was that, the question is that true for every state? And the answer is yes. So the package of services differ, but everywhere there's differences in what the extra services and the regular services participants reported to us that they received. Now, we also can use administrative records, so we don't need to just rely on people's reports of services. So we know, for example, how many people got contempt hearings in the first year and how many people got a warrant issued for their arrest, how many people had their license suspended. And so here you see that people in the extra services group were less subject to these punitive enforcement actions. So all these differences are statistically significant. But it's not very big, right? 14% versus 16%. So statistically important. And if you're in that 2%, pretty important to you personally. But in the big picture, not robust intervention itself. Okay, everybody with me here? Wisconsin, similar differences, but because the sample size is smaller, they're generally not significant. But the direction is the same. So people faced fewer enforcement actions, less likely to face punitive enforcement actions, but the difference is not real big. Okay. So then what do we see in the impact analysis overall? So I'm going to spend a little bit of time on this slide because you'll see several of them. So blue is always about the extra services. Orange is always about the regular services. This is about the amount of child support owed, totaled across all the people that I owe money to. And you'll see there's some stars by those blue bars. So these are monthly amounts, and so people in the extra services group at the end of that first year owed $308 a month compared to $323 for people in the regular services group. Okay, so a difference. So people, what we interpret this here is that people in the extra services group had their orders modified and made maybe more appropriate to their ability to pay, given that they were having such employment difficulties. Continues in the second year. And then, if you lower what someone owes, then it turns out that there's a little less paid for the blue bar. Now, this finding is not nearly as strong as this finding. So you can tell that by the number of stars there. So this is we're pretty sure about this one. This one is a little less robust, and it depends a little bit on how you count it. And there's all kinds of nuance that I'm happy to talk about. But the bottom line is $5 less a month the first year, $8 less a month the second year. Now this, to be frank, was the slide that was predetermined to be the very most important slide. So we wanted to see owed, paid divided by owed as our central measure of success, and there is no success by that measure. Okay? Now, one of the things I said before is look at the difference for both groups between year 1 and year 2. So everybody's doing better over time. It's just that we're not doing differentially better. Okay, so far it's a story of lower orders, somewhat lower payments, no difference in compliance. Here's a huge impact. And this is an impact in your satisfaction with child support services. So 68% very or extremely satisfied. Actually, I don't remember the exact words. Compared to 46%. So a huge difference in how people felt about their interactions with the child support system. These are the NCPs. NCP's reports of how satisfied they are with the services they receive. So this is the level of difference here is the level that you don't typically see in these sorts of experiments. This is very, very large. We're going to come back and talk a little more about that. So we also did some other things in the child support area. This is just a summary of those. One thing maybe to point out is we have a measure of whether orders were burdensome, that is, whether you owed more than half of your earnings in child support, and we do see an impact there. Wisconsin results, so I showed you the overall, that the orders went down and payments went down. We don't see that in Wisconsin. Orders go up or essentially flat. Payments go up just a little bit, but compliance is not significantly different. So there's some glimmers of hope in Wisconsin for the main thing we were trying to do, but it's not statistically significant. The Wisconsin numbers, increase in satisfaction is high and significant. All right. The second area is employment and earnings. Here, no effect on employment. These are months employed from self-reports or quarters employed from administrative records. In earnings, you see that the blue bars are slightly higher in those first two sets. That's the difference between survey and admin, and in admin, it's statistically significant. Here's our summary, no effect on employment. Mixed results on earnings in admin data, but it's pretty small, 4% a year, not survey. Wisconsin results, similar to the overall, no effect on employment. In the first 8 quarters after enrollment, we see significant effects, increased earnings in 3 of those 8 quarters. So sort of suggestive that things were working well, but not strong enough to trump it. Okay. The third main area then was this parenting area, and what we chose to look at here was a sense of responsibility for children. There's a scale. You see the questions that we asked there. So this is trying to tap into, do NCPs believe that NCPs should be supporting their children in different kinds of circumstances? And here we see statistically significant effects, but fairly small. And I hit the wrong button. Summary. So the sense of responsibility for children was the confirmatory outcome. The outcome that we determined prior to starting was going to be the main thing we looked at. We did look at some other things. So there is increased contact. about a day a month, a decline in harsh discipline strategies. But we looked at a lot of parenting things, and the overall parenting story is there's not a lot of impact on parenting behaviors. Wisconsin results are even a little more negative than that for the parenting. We looked at some other things too. Criminal justice involvement and emotional well-being. There's a Wisconsin result that we have better data in Wisconsin than anywhere else, as you might imagine. And we can see less likely to be arrested in Wisconsin. But again, the effects are not overwhelmingly large. There are impacts in economic well-being, some scattered things in public benefit use. We tried to look at custodial parents as well as non-custodial parents, and basically there's no impacts there. We looked at subgroups. We looked at different grantees or states. So here I am going to show you the state level differences. But the bottom line for states is, sometimes people are interested in, was there one state where this worked? No. So there are different states that did better than other states on different areas, but mostly the intervention had similar impacts across states. And you can kind of see that here. Here's by grantees with Wisconsin highlighted. Look, for example, at this last row. This is the reported satisfaction row. This is the impact. You see stars in every column, right? You see particularly large stars in Tennessee, and partly this is because Tennessee started quite low. So they had more room to increase satisfaction. And as I said before, so we see orders which went down overall. That's primarily an Ohio result where they went down lots. Wisconsin, essentially the same, $3 a month increase. And then payments, you're starting to see payments improve, the impact on payments improve in Wisconsin, but still not statistically significant. Here's the results on employment and earnings. I hinted at this before, the Wisconsin results. No stars here, but hopeful results. And that's going to bring us to some bottom lines. So I want to say just a couple things here quickly before I turn this over to Lisa. So in terms of the impact, here's some of our takeaways. Can child support lead an intervention that has all these components? Yes. So this mostly comes from the implementation analysis, but also from the impact analysis. So this thing that we weren't sure could actually be pulled off in 8 different states, yes. Can the child support program be changed to be less punitive? Yes. Again, the impact is there, but it's not dramatically different. Does a new approach change attitudes? Yes. Major improvements here. Does a new approach substantially increase or decrease payments and compliance? No. So I would say modest declines in payments, but no measurable change in compliance. Why were these impacts so modest? So here's some of our answers to that question. Trying to pull on things that we've said in this conversation so far. So a very disadvantaged population, right? Essentially 2/3 of people with criminal records, 1/4 of people with significant mental health challenges, relatively modest intervention in the face of those significant barriers. So maybe the reason the impacts are modest is because we underestimated the degree of disadvantage and did not provide a robust enough intervention. Another possibility that I want to just talk about for a second is there's a problem with an experimental design. So in an experimental design, so this is not like you're giving people a drug and a placebo, and you're really clear that the drug person is getting a drug and the placebo person is getting a placebo. What we're doing here is we're saying you get extra services and you get regular services. But if the people delivering extra services are excited about what they're delivering, and they were and are talking about how this approach to child support is important and going to be effective and much better for our interactions with our customers, then some of that might bleed over into this regular service group. And that makes it really hard to get a good contrast between the extra and the regular. And the only thing we're working off of here in this evaluation is the contrast, right? The only measure we have of whether this program worked is how the extra services people did compared to the regular services. So if the regular services people are getting a little more than they used to, then we haven't taken that into account. And then the last thing I want to say, and this is really relevant to Wisconsin's plans, is that new program models might become more effective over time. So we saw this very large change in how people felt about the system. So you might imagine that that will affect cooperation, and that those kinds of new relationships between NCPs and the child support system would take a while to show in important results. So we don't, it could be that this was just too slow for us to see impacts. Now I want to talk about the benefit cost analysis, and I limited myself to one slide here, so I'm going to wave my hands over lots and lots of detail. But here's the bottom lines. So modest additional costs, so about $2,500 of costs for this package of services per person. And there were some benefits that we could see, and you can't assign a dollar value to all the benefits, but you can to some. And the benefits that we could assign a dollar value to, $1,600. And then there's the distribution. So the costs, the top number is higher than that second number. But in this kind of analysis, what you typically see are benefits that roll out over time. So you have a cost in 1 year of these services, but that then has ripples that get smaller over time, right? You'd expect a bigger impact in the first year than the second, and then smaller in the third, and maybe nothing in the fourth. So you have to estimate the decline in benefits, but under every reasonable assumption, the benefits would outweigh the costs in the longer term. Okay, now I'm going to turn this over to Lisa now. She's going to talk a little bit about, so that's mostly the results of the quantitative analysis. I could probably take 2 questions maybe about that. What we want to do is talk more about things we learned from our interactions and our observations with staff and partners and NCPs themselves. Yeah. Here comes the microphone.
The folks on the phone can
Hi, Dan. Thank you. This has been great. I actually wanted to get a little bit more information regarding the scale, sort of your assessment of it as a good and solid construct. I don't think I caught what the range was, and so, and I didn't think I caught whether there was a pre and poster versus just sort of a treatment and control analysis of that scale.
So do you mean the parenting scale or the
Yeah,
satisfaction scale?
the sense of responsibility for
Okay,
children one?
Great. So the, oh boy. So these are 4 questions in the follow-up survey. So about a year after people entered the program. This is an EC comparison, so it's not a pre-post comparison. So if the random assignment worked and people got different things in the extra services group from the regular services group, then this gives us a measure of the impact of the program. Right? So you don't need a pre-measure. A pre-measure would have been nice just to help us descriptively think about. These questions did come from, some of you may have heard of the Fragile Families study, so they did come from there, so we have some sense of how our dads compared to other dads. But these are each 5, a Likert scale with 5 options, and then this is an average, and so people's averages are in the low 4s, so they're mostly agreeing with these statements, but not strongly agree. So that 4 would be agree, 5 would be strongly agree, 3 is typically neither, 2 is disagree, 1 is strongly disagree. So general agreement with these statements, not necessarily strong agreement. Did that answer your question? Yeah. Would say no. Yeah. Yeah, great. So so a general comment first. I'm often surprised in surveys at people who report what I would think of as non-normative answers, or people who disclose things that they know put them in somewhat of a vulnerable position. So the question about incarceration, for example, is a self-disclosure comment with, 2/3 of people saying, yes, I've been in jail or prison. So that kind of surprises me because you expect the bias to be people underreporting. Here, these are questions that I think in general societal terms have a right answer. Right? You more or less expect people to strongly agree with these, but we don't see straight 5s across people. And in fact, we see some differences between B's and C's. Now, we could talk more about the importance of attitudes versus behaviors, right? And not today, since I can see the clock. We could talk about that. But one of the things we're trying to assess in the SPSK follow-up is we're trying to keep looking at some of these attitudinal differences to see if they have some longer-term effects. Great. One more.
Does all these questions ask when the program start? So So you can have a comparison before and after.
For these questions particularly, or in general? So these questions are about have an implied time reference of today, and it's asked at a year in, after you've received some parenting services, not 16 hours apparently, but after you've received some parenting services. Yeah. A quick question? Okay, I'm going to turn this over to Lisa, who's going to talk a little bit more about things we learned from staff. You're watching the clock, right?
Okay, I'm going to get us back to
Oh,
where we
sorry.
were. No, that's okay. Is anybody feeling a little bummed out right now? Yeah? You're kind of hoping for something else, right? All right. Well, what I'm going to talk about now kind of builds off of one of the most stark findings that we identified throughout the course of the evaluation, which is this change in attitudes or change in perceptions amongst non-custodial parents towards the child support agency. So kind of pulling together everything that we talked about today, I want to speak to two kind of overarching questions. So given what we know about the things that get in the way of compliance with child support obligations, how can we best align services to meet the needs that non-custodial parents have? But how can we overcome those feelings of mistrust that we know that some non-custodial parents have to make them willing to engage in services at all? Because it kind of doesn't matter how great your package of services is if nobody's willing to show up to take part in them because they're afraid to interact with you. So to answer these questions, we talked to child support and partner agency staff. And what we heard from child support and partner agency staff about how to change perceptions amongst non-custodial parents is that there are two core components to this. And the first is that what kinds of services are provided absolutely matters, because it's important to come at non-custodial parents with a true offer of service, with something that can really help to improve their own situations and well-being and hopefully get them closer to compliance. But how we deliver services is absolutely critical. In order to change perceptions, it takes a change in agency culture to really get non-custodial parents to be willing to do something different. So policies and practices aimed at facilitating this shift require service innovations and kind of doing things proactively, and we'll talk more about that in a moment, as well as committed and supported staff, collaboration with community partners, and strong leaders within child support. I'm going to go through each of these now. Okay, so some key implications for service content. Well, as we learned, child support programs can in fact help to address some of the barriers to compliance. And some of these promising strategies that we identified throughout the CSPED evaluation that might be, again, something we're thinking about as we're transitioning into FCDP are things like proactive review and adjustment of orders when appropriate, especially for those high-burden cases. And that means not waiting until the time threshold comes, not waiting until a non-custodial parent seeks it out, trying to figure out what's going on proactively when non-custodial parents get behind. We also heard that not many non-custodial parents experience a lot of difficulty obtaining modifications. And this happens in a couple of different ways. Some people aren't aware that they can get a modification. Some people have literacy barriers that make it really difficult to walk through the paperwork of getting an evaluation, a modification. And so what we heard is that simplifying those processes and getting rid of some of those barriers can be really helpful for non-custodial parents obtaining a modification and hopefully bringing that order into something consistent with what they can do. Another kind of key takeaway here is that thinking about enforcement tools kind of carefully and thinking about what's the best tool for the job instead of applying something globally is something that we might want to consider. So not always slapping that license suspension in place, but thinking about, is this going to be something that's going to get me where I want to be with this non-custodial parent, or is it something that could make a bad situation worse? And again here, just identifying resources to connect non-custodial parents outside of child support to things like visitation that could improve that willingness to comply. Within the domain of service content, again, we know that many non-custodial parents need help beyond child support services to address the complicated barriers that they have to work in compliance. As we've talked about, a bunch of things get in the way. Sometimes those things need to be addressed first. So what can we do about it? Federal, state, local prioritization of resources to help meet those unmet needs. And what we learned from CSPED grantees is sometimes that takes seeking out additional grants or funding sources to help leverage those resources. We also heard from our CSPED grantees that takes figuring out who in the community is already doing this kind of work. So sometimes child support agencies, what we heard from child support staff, is that they can be a little siloed. They're not always aware of what's going on in the community and what else other folks are doing. So figuring out who's providing mental health services, who's the really strong employment provider within the area, and how do we figure out who a point person is over there so that I can take my non-custodial parent, send them to somebody who I know and I can follow up with to see how things are going, and really cultivating and nurturing those relationships over time. We also heard about the importance of collaborative case management across providers. So not only providing those child support services, but reaching out to the employment provider who's providing services and ask, how are things going? What kinds of things can we do? Are you learning about new barriers that I should be thinking about as well, and where can we connect folks? Third implication for service content, Some non-custodial parents are going to need more intensive support related to finding and keeping work than others, and that's particularly the case for those with criminal records. So some strategies here, we want to think about investing in training programs, potentially to build pathways to higher paying jobs, facilitating connections to basic education programs, given that that's an issue of need for some non-custodial parents, and particularly for our folks with criminal records, thinking about how can we develop and intensify services for those folks to get them ready to re-enter the labor force. Something that emerged as really important from CSPED was seeking out felony-friendly employers. So figuring out who in my community is willing to employ felons and how can I have a good relationship with them. And sometimes that meant leveraging employer providers who already know who will hire somebody within the community who has a criminal record, and figuring out how we can send people over there and communicate with those folks so we can hopefully keep sending non-custodial parents with records over. That also takes some training with non-custodial parents on how to handle questions about their background in the course of interviews. A lot of our CSPED employment providers did that, talking about what went wrong, how things are going to go better in the future, and how to describe the federal bonding program as a potential resource for them. And then finally, we heard that some of our CSPED grantees were able to have a lot of success facilitating expungement services, even doing things like hosting expungement clinics in their facilities for non-custodial parents, as well as identifying community partners such as local solicitor's office who could prioritize CSPED participants for potential expungement review. And so facilitating those kinds of relationships can really help our non-custodial parents who have barriers to employment due to incarceration. Okay, so the key role of culture change really takes figuring out how we're going to get non-custodial parents to trust child support again. And what we hear here is that when and how services are implemented is really important. So some strategies that emerged from our CSPED providers included things like intervening early, not waiting until somebody's very far behind, thousands of dollars behind, but instead, as soon as we miss a payment, making a phone call and figuring out what's going on, what's the context. That involves strong communication and really investing in time in relationships to identify context and barriers. It might also involve some retraining on service-oriented approaches, particularly for our staff who might have been doing work in an enforcement-oriented approach for quite a long time. We talked with staff about changes to accessibility. So CSPED staff told us that they made changes such as working in an accessible office. So instead of requiring a non-custodial parent to call on the phone, sometimes even when the worker is just across the wall, instead meeting with that person face-to-face. And that really helps to facilitate building the relationship, as well as providing direct telephone numbers instead of having to route through a phone bank that might take a lot of time and effort to actually ultimately reach the caseworker. Some additional promising strategies that we heard about here included co-location. So having our child support agency, or at least a representative from the child support agency, physically located in the same place as other human services providers in the community. And that helps to not only show we are a service agency, not just an enforcement agency, but also helps to facilitate shared case management. So if Dan's an employment provider, I'm a child support provider, and I want to talk to Dan, it's really easy if we run into each other by the water cooler or in the hallway. It's also a way to facilitate warm handoffs. So if I've got a non-custodial parent who I've finally built up a good relationship with, and gosh, I'd like to get them to engage in services, if I can walk them down the hall to Dan, hand them over, and make an introduction, that facilitated introduction can go a long way in getting non-custodial parents to stick around and engage in services. And finally, we heard from our CSPED staff that co-appearances with community providers, so showing up at fatherhood, special events in the community, showing up when human services go out into the community to explain what kinds of resources they have available to them, goes a long way in demonstrating that we're doing child support differently now. So I want to talk about sort of 3 key ingredients to culture change. I know I've just got a couple of minutes before we take questions, so I'm going to skip through this a little bit quickly, but bear with me here. So we asked staff what kinds of things help to demonstrate this commitment to a new way of doing child support. And what we heard is that having the right staff is absolutely crucial. Having staff that are dedicated to a new way of doing business, who provide a consistent face of service, who non-custodial parents can come to rely on, and who are strong communicators both with non-custodial parents as well as with partner organizations, are really critical for customer engagement, cultivating that trust, figuring out what the right resources are in the community and how we might leverage opportunities to connect folks to resources, and following through with non-custodial parents. I just want to emphasize here, though, that comes intensive services. We can't just say, okay, caseworker who has an 800-person caseload, start calling everybody on the phone every day. That's not going to work, right? So there needs to be some staffing adjustments often to help make that happen. And what we heard is that that can look different in different contexts. So what we heard from CSPED staff is that having one person responsible for everybody on the CSPED caseload was often something that contributed to burnout, and also meant that if that person quits because they're burnt out or gets sick or something like that, then you could have these service gaps where all of a sudden there's nobody to really do that work. So doing things like cross-training, making sure that there are people who can provide backups was really important for facilitating continuity in services as well as preventing burnout. We also heard that partnerships offer many benefits to child support agencies as they set out to do this work. By having strong, robust partnerships, we are as strong as our complete network of partners. So our partners have access to a broad array of services to address unmet needs that employment providers are going to know of resources for mental health and substance use issues that our child support workers might not, and vice versa. So by leveraging those relationships, we have more collective resources. Unique strengths and expertise as well. Partners they do what they do best, and that allows child support workers to do what they do best as far as working with noncustodial parents. Partners often have different relationships with noncustodial parents. So we talked earlier about some of the baggage that comes with the child support program that our noncustodial parents sometimes perceive the child support agency as being not as friendly of an agency, whereas with partners tend to have a pretty neutral to positive reputation amongst noncustodial parents. And that can just help to provide an in and to provide some different insights into behavior. And crucial to all of this, we heard that leadership in the child support agency is absolutely critical for setting the stage to service delivery. We heard that strong leaders provide direction and oversight. They help to set the message that prioritization and facilitating customer communication is something that we're going to do as an agency. They help to hire staff. Sometimes we heard about hiring staff with a social work mindset, staff who are interested in doing services differently. Setting expectations about what service delivery might look like and figuring out who's going to be responsible for what. Strong leaders also made space for innovation, meaning that when a worker had a great idea of how might we do something to help noncustodial parents feel more comfortable coming in here to connect them to this resource, creating room for those sorts of ideas to come about, as well as for cultivating and sustaining partner relationships. So really taking the lead and figuring out how to identify and then nurture relationships across partners. And finally, leaders can be very helpful in establishing communication practices within and across agencies. Okay, so that's where we wrap up. Hope this was somewhat helpful in thinking about what we sought out to do with CSPED, what we learned, and what we might think about going into FCDP. But we are happy to take questions now on this or anything throughout the course of the discussion.
This is a simple one. I know you're focusing on your national evaluation work, but off the top of your head, anything stand out as a difference between Brown and Kenosha counties as far as either outcomes or changes in the agency and the way they approach things? Or
do you want to speak to outcomes and I can talk about changes?
So, do you mean between Brown and Kenosha, or between Brown and Kenosha and everybody else?
No, I meant between Brown and Kenosha. I know you probably did a report that you delivered to someone, but I haven't seen it. I was just
no,
and so
actually,
I was also
we
just
haven't.
kind of
Yeah.
I was also kind of testing, like I say, making it open-ended. Like anything really stand out to you that was the difference between our two participating locations?
So we have done only a very small amount of cross-site work. So I can't, the work that we've done has not showed dramatically different impacts.
In regards to service implementation, there were some things that were done a little bit differently. But I would say that what really struck me about Wisconsin is that we have leaders who are so committed to doing things differently, to innovating, to connecting with those community resources, and to really being attuned to the needs that noncustodial parents have. So even though some smaller differences in structure and things like that, overall really committed and strong leaders and committed and dedicated staff.
You talked a lot about training and how important that was, and so I was wondering, did In the design of the evaluation, did you have any consistent training that you were asking these different sites to give to their workers, or was it up to their discretion of what they wanted
That's
to
a good
look like?
question. So there are two different kinds of training that we employed throughout the course of CSPED. Some is evaluation-specific training, meaning that folks like Dan and I went out at the outset of this and tried to convince our staff about the virtues of random assignment and get them on board with being willing to do that. We also provided training related to tracking services in the grantee management information system. That's something that was required for everybody who took part. So that sort of training was under our control as the evaluation team. Other kinds of training requirements were not consistently required across grantees.
But there were monthly calls, and there at OCSC there was a person tasked with essentially fidelity. So trying to make sure that any problems with implementation were recognized and addressed, and the staff had what they needed to deliver the services.
We also created some short-term reports to just kind of show what things look like across a number of domains, and that information was provided back to grantees monthly as well. So while not training per se, it's sort of a way that the evaluation team interacted with a training component.
Right. So, and not surprising from the Department of Workforce Development, I'd be asking about workforce. But so one of the things we've been seeing both in DVR and other employment and training is the use of motivational interviewing and really taking the person where they need to be taken on the pace that they want to be taken. And I don't know if the study did this, but if the referrals back to the experts, because when you just have these potpourri services, some of those are really surface and they don't really get deep into what the needs of the individual might have been. So one of the things we're looking at in workforce is not necessarily having the case manager know everything and doing warm handoffs, but having a navigator that actually becomes the advocate for the person, and that they're the ones connecting them to the services and really understanding what they need. So I'm wondering if that might be a promising practice. I know for the Promise Grant, having those family navigators was incredibly powerful and actually did make a statistical difference for those families.
That's a great question. So I can speak to that from an implementation perspective. Something that we heard time and again from our staff, both on the employment side as well as on the child support side, is something that really resonated with what you just said, which is meeting the non-custodial parent where they're at and figuring out what it's going to take to get them to where we want to go, and kind of establishing those goals collectively of having a shared plan of how are we going to do this. I think I mentioned a little earlier, so the specific configurations looked a little different as far as how were services implemented. Generally, there was someone within the employment agency who was like a point person case manager who interacted with job developers and with other folks who could help to provide those supportive services. Some grantees gave that person a lot of time to spend with non-custodial parents and kind of figure out what those barriers are. So I think absolutely that's something to consider. What we hear time and again, there's a quote that I usually close with, but since we were short on time, I didn't include it here, is a child support project manager paraphrasing what they hear from CSPED participants, and that is that regardless of everything else, it's the passionate case managers who make a difference. It's the people who spend that time to figure out what's it going to take to get this person there, and who really know them on a personal level, much like it sounds like a navigator would be useful for in that way. So it's a great point. Thank you.
Were there any, so as part of this kind of network, were there any criminal justice related partners or apologies if it was in here and I missed it. You know, it just sounded like a lot of the barriers were related to that, like probation officers or like court involvement. Like, was that part of the case management as well?
That's a great question. So not required and built in, but there are a couple different ways where programs ended up interfacing with law enforcement. So one is that as a recruitment source, probation and parole became really important for some grantees, where those folks were saying, hey, I've got people on my caseload who might be a good fit for this kind of program, and sending them over. Some grantees were able to build relationships with legal aid and to facilitate relationships over to legal aid, although that wasn't required and it wasn't consistent. There was certainly effort from our different programs to try to build those relationships. Expungement ended up being something where a lot of grantees tried to get traction, and some of them did, as I think I mentioned, things like these facilitated clinics in-house by building that relationship with people who facilitate that work. But there was a lot of variation there, and some just hit a wall where legally they weren't able to get anything done.
Say
Because
Wisconsin
of the rules
has very, very
yeah. Yeah, great question.
So last question, and then I want to talk just two closing sentences about what's happening next.
Which is related to my question. So under the new waiver, what are we doing differently than was done under here, and what results do we expect from it? What changes?
So Hillary's going to answer that question.
Well, I can't speak specifically for what they're doing differently programmatically. Is there anyone from BCS here that's working on the group? Working on FCDD? Okay. But we are talking a lot about these results and thinking about, especially like the service fits. I know there's still, choosing counties and thinking about those kinds of things. The evaluation will be slightly different in that it won't be a randomized controlled trial. It will be using a difference in difference analysis, so it'll be trying to take the 5 counties that are doing this and trying to find a comparison group out in the rest of the state that's not doing the program and try to find non-custodial parents that look like them. So that provides, that has some limitations on the evaluation. It does take care of the bleed over problem that Dan talked about, so that's the one plus to it. The other thing that'll be a little bit different is that we are trying to think a little bit more about custodial parents and how they interact with the program. So you saw that one of the findings, and I think this is true in other programs, the learning exchange that we had last week about incarcerated parents, that gatekeeping mechanism with custodial parents is really important in thinking about how we work with the whole family and not just non-custodial parents and custodial parents separately. So we are going to be doing some, trying to do some focus groups with custodial parents, and I know that the work group has been talking more about how they can sort of reach out to custodial parents as well. But the program, I think generally the 4 components are still there, but hopefully that we're learning some lessons from CSPED in thinking about how the service alignment happens and evaluation, thinking about what we learned here. We will keep a lot of the measures the same. That's really useful for us to see if, adjustments that are made in this program or this round of the program are helpful. But we will be, like I said, adding a few different things in.
Okay, and I want to just say a couple things that are happening next. So in the Child Support Research Agreement, we're taking 3 things that we learned here and taking them kind of to the next level. So one of the things that we learned here that we've talked about quite a bit is these barriers to employment. And so we're doing a more focused look at kind of the extent of different barriers, the way the barriers interact with each other, and then the ways that those identified barriers play out in employment, earnings, child support, orders, and payments. So that's one piece. Another piece that you saw here is these very, very large differences in satisfaction with services. So that's kind of a new area in the child support world. We don't have any analyses in the US that I'm aware of that look at factors that might be related to satisfaction with services. So we're doing some work to try to see if we can understand what helps customers be more satisfied with the services, and then does that matter? So people who are satisfied, do we then see later changes in payments from the people who felt like they got the services that they wanted? So that's a second thing. The third thing we're doing is this is a relatively straightforward impact analysis. So we're doing a little more work trying to understand the mechanisms by which we saw effects or non-effects. So you could imagine that this intervention, which is fairly complicated, right? We're hoping to provide some employment services, which would then increase employment. We're hoping to provide some parenting services that would then increase the sense of responsibility for children. We're hoping to provide a different approach to child support, which would lead to satisfaction with child support services. And then increased satisfaction, increased sense of responsibility, and increased employment together should all come and increase compliance. So that didn't work. That broke down somewhere. And so what we're trying to do is now tease out where things worked and didn't work so we can use that information in the next round. Bottom line here depends a little bit on if you're a glass half empty or half full person. So the half empty story is we tried to change compliance with a brand new array of services, and we didn't. The half full story is we dramatically changed the services that people got and the satisfaction that they had with those services. And we think that that will play out into important effects in the future.
One more thing that I think is important going forward too. So you talked about, Dan, in the benefit cost slide, that usually we expect diminishing returns from an intervention. That usually we would expect diminishing returns from an intervention. But you also, somewhere in this presentation, talked about how sometimes you need to take care of X, like housing or whatever. So actually, some of the theory of this program is we might not expect bigger outcomes in year one, but we might expect a different trajectory long term. So how, and that's sort of borne out by the cost benefit analysis, right? But could you talk just a tiny bit more about that, and are you doing any more analysis on that from your end with CSPED, like any additional longer term outcomes?
So we are hoping to do some longer term outcomes. There is we are still working on the human subjects permission to do that. One thing we do have, so some of you know this and some of you don't, so in the next round of SPSK, so we are continuing to work with Brown and Kenosha. So we will have a longer term panel for the Brown and Kenosha NCPs. So we will be able to do some work with that, even if we're unsuccessful in convincing our IRB that we should be able to look at outcomes after the formal evaluation is over. Thank you.